So today in the Hope Clinic, we have Sarah. So Sarah's coming to us with what she's referred to as white coat syndrome, but she also mentions sort of the main thing being a fear of needles and blood. So my suspicion is that's probably where it started, but then it's grown to anything medical.
Okay, and that's interesting, isn't it? That a lot of people feel that their issue as they get older is becoming, more life-consuming. And ultimately, when you have a phobia, that is what happens. It might have started just with needles, but then she's associated needles with blood, and then she's associated blood with injury, and then injury with medical sort of problems, and then medical problems to anybody in the medical community that works in medicine, etc. And that's why I think so many people's phobias feel like they're getting worse, because they're adding more and more triggers in.
Yeah, absolutely. And I think that can, obviously we're trying to share hope. And I think that's one thing that can really sort of prevent people feeling hopeful, because if they understand they've just got one thing, so let's say this is just a fear of needles that has grown, then it doesn't feel that bad because I've just got a fear of needles. But if that starts to progress and grow with time, and it becomes also added in, hospitals, medical procedures, like you said, anyone in the medical profession, suddenly you can feel quite hopeless because I've got such a huge issue now with so many triggers and so many different things that make me anxious. It can ultimately end up in becoming a label of generalized anxiety. And really it all started with one thing, but that can lead you feeling quite out of control.
When it becomes all-encompassing, which is what this sounds it is, we know that it started off younger, and because it's a less developed brain, should we say, that's taken on board some situation, and it's gone from there, and there's been a longer length of time. And also you get other people who add things to that, like giving labels, like white coat syndrome, for example, because that wasn't an issue, but someone says, oh, actually, it must be that. So now that's part of the problem as well.
But it's interesting, and it'd be interesting to hear with Sarah how this has progressed, because it can be all-consuming. It can mean that you create health anxiety, for example, because you know that if you get ill, that might mean you need to face an injection. It could also mean that, for some people, that I can't have children, or I can't do that job because I might be more at risk. So it'd be really interesting to see where she's at and how far this has progressed.
And this is, I'm so glad she's come to see us today, because that fear of illness is so counterproductive and actually puts her in danger, because by not seeking help when she might be ill,
True.
then that could make her a lot worse. And we know actually from a lady that we worked with in the past who came to see us for the very same thing, and shortly afterwards went for a scan and got diagnosed with cancer. And she was told, had she not done something about it, even a week would have made a difference between life and death.
Yeah, and it's interesting that this phobia can actually prevent people from being healthy as well. I mean, I know that a lot of people with this problem, for example, won't exercise because they're scared of elevating their heart rate, and it can really progress into so many areas. But ultimately, one thing we know is it all starts in one place. No matter how big it grows, there's a start point. And I think it'd be really interesting to see with Sarah, despite all these things that are going on, where did it all begin? And hopefully we can identify that today.
Hello, Sarah.
Hi.
Welcome to our Hope Clinic. This is your half hour of hope. So what is it that you're here about? How can we give you some hope towards your healing?
So I suffer with what people have described to me as white coat syndrome. So I have a fear of needles, blood, generally like medical scenarios. Big thing for me is a blood test. I've never had a blood test.
Wow.
So it's basically become sort of more overwhelming as I've got older, and it's just become something that I've struggled to control and get ahead of, basically.
So can I ask, how do you feel about hospitals?
Hate them.
Have you been in hospitals?
Very rarely.
Times?
I am a very cautious person to avoid ever getting into any sort of accident or hurting myself. I've visited my grandma on her deathbed, and that's about it.
And what about children?
I'm a nanny for my job, and so I have also been very cautious with them to avoid them getting into accidents. And I'm very lucky that the family that I work for understand my phobia, and if they do get into a scrape, it tends to be them that tend to take over, but there have been incidents where I have had to step up, but I've been an absolute mess.
But what about you having kids? Would you have children?
Oh,
Have you got children?
It's completely been ruled out for me because I will not have a blood test or go into hospital or even consider anything in that
So
frame
it's
of
going to say
mind.
completely ruled out, but you're a nanny, you love kids.
Yes, I love children. I'm like, I would say I'm a maternal person, but it's sort of even stopping me from getting into relationships because I don't want to then have a conversation with someone that says, oh, I'm too scared to have a blood test, therefore I don't want to have a child. So it's a huge block. Like I've never had a boyfriend. I've never been in a relationship.
Oh, Sarah.
Just because I think I don't want to prevent that person from having a child. And I also don't want to meet someone and think, I'd love to have your child, but I'm too scared to go through that process, if that makes sense.
So what we're saying, this isn't just hope. This could completely change your life.
Oh, yeah, yeah.
I mean, immensely.
Yeah.
I mean, it actually, literally, it breaks my heart to hear you say that.
Yeah.
And mine.
Yeah. But
Yeah, my friends are like, because especially at the moment, like my two best friends have literally just both had babies back to back in the last month. And I look at them and I think I would want that more than anything in the world. But there's this huge roadblock in front of me, stopping me from getting to that point.
And have you ever had any therapy? Have you seen anybody about this?
I did actually, after COVID, because I had to have COVID jabs. And that was a horrendous experience for me. I had to have my mum, I basically blindfolded myself, put headphones in, and my mum basically got me into the room. I was injected and then she got me out again. So I looked insane. The people in the waiting room must have thought, what on earth is going on? But that was the only way I could get in there to actually have my COVID jab. But after that, I was like, this is ridiculous. I need to do something about it. But I did try and have some hypnotherapy, but I didn't find that beneficial. I had about 10 sessions, and the only thing that I got to the bottom of was that I'm slightly scared of heights, but actually I'm not. I fly, I do lots of different things, but she said that she could see that I was more scared of a drop because I was scared of hurting myself because it meant that I'd end up in hospital.
Yeah.
So they're linked. But that was the only thing I got out of it. I didn't really find it beneficial. I
But
never got to that state of...
It's what comes first, and the fact that you're concerned about falling off a drop because you're going to go to hospital and is the issue, not the drop.
No.
And being a bit controversial here, I just don't think that hypnotherapy is the way forward for such a severe fear, because basically what a hypnotherapist is trying to do is speak to your sort of subconscious to help you to feel more relaxed. But when you are on such high alert that you can't even have children in your life as a become a mum, then the barrier is going to be up, and there is no way that you could go into a hypnotic state.
Yeah, like high alert is, you've hit the nail on the head there. Like if you met me, you'd know I am almost always on high alert.
Of course, because everything in life is a threat.
Yeah.
You can't cut your finger, you
Everything.
can't trip over, you can't be in an accident.
Yeah.
Like literally, you must absolutely be exhausted. How do you sleep?
But horrendously.
Right.
Because my mind's just like whirring the whole
and
time.
that's really interesting. One thing we find with people that have got a phobia like yours, that because so for example, if you had a phobia of a cat, for example, that would be easier to avoid, so you don't exercise it as much. But when you have a phobia like yours and you're trying to avoid blood, realistically, you're almost avoiding absolutely everything in life.
Yeah, like even like mundane things, like when I empty the dishwasher, I like check that there's no knives pointing upwards, or if there's a glass broken, I'm super cautious that I'm not going to cut myself or like need stitches, or I'm on.
It must be exhausting. And what's interesting, and you might not be aware of this, but when you have a phobia, and this is anybody that has a phobia, but particularly when it's very consuming like yours, that it's almost like a program on a computer that you cannot switch off because you need to be on high alert. So even sleeping, your quality of sleep will be affected by this. So if we were to say to you, just to give us kind of an idea of how you're feeling at the start of our conversation, to sort of in our sort of a half hour, if you were to think, or I say to you, think about having a blood test, and you had to score that between 0 and 10, and 10 being like, oh my God, the thought of it is just horrific, 0 being, I'm totally chilled with that, where would you be?
10.
Gosh.
There's no doubt about that.
I mean, Eva, I've got to say here, can you look at Sarah's face?
No, I can see
you
it.
Do I
say,
look petrified?
oh
You
my
do.
goodness,
Yeah.
Sarah, honestly, you're like a coiled spring.
Yeah.
Right. So
Totally.
Definitely.
What I would like to ask you is, knowing that you're so fearful of any medical intervention, and that's what this is.
Yeah.
Looking around this room, what frightens you in this room? What could happen in this room that you could end up in a hospital that really frightens you when you think about it?
Yeah, absolutely nothing. It sometimes even like discussing it. Like there was a woman on the train talking about the fact that she'd been put under to have a tooth out, and I could hear the conversation going on, and I was like, I don't want to hear her talking about it. Even talking about things in that sense, really, I like tense right up.
So you just brought that up now,
Yeah.
right? So just tell me again briefly about that conversation, if you will. The lady on the train.
Yeah, so she was just talking about the fact that she'd been put under anaesthetic to have a tooth out.
Okay, so out of 10 being the worst.
Yeah.
How does that make you feel?
When she was talking about
Yeah.
it,
Thinking
or
about it now.
more mild, more like a 5 or a 6, like uncomfortable but not
Okay.
terrified.
And
Okay.
And then my final question, you don't have to answer if you don't want, if it's a little bit too personal, but just like time of the month, because we've worked with people who have a fear of blood that it's that bad.
It's funny you should say that. I've never had a problem with that.
Fine. Okay. And that's fine too.
Yeah.
Yep. Okay, good.
But I've never really linked that before. But
Okay.
no,
So your
don't
face
have
has totally changed there now.
Yeah,
Yeah, yeah,
relax.
wow,
No,
yeah.
that I'm fine with. Have you found something I'm comfortable with? Yeah, no, that I'm fine with.
Okay.
Excuse me
And
1 second.
so, well, the good news is, Sarah, that you weren't born with this. So nobody,
Pause. Just say that again and leave a pause at the end.
I was just going to conclude with another line and then pause, but
Okay,
okay. So, yeah, the good news is that nobody is born with a phobia of blood or needles.
Did you know that?
I mean, I'd hoped so.
Yeah. Well, we can tell you that categorically.
Yeah.
That nobody is born with a phobia. And I'm going to also tell you that a phobia, by definition, is an irrational fear. So what that tells us is that something has occurred in your life which you misunderstood and therefore created this fear. And usually we tend to find most commonly between the ages of 3 and 13, usually.
But in situations like this, I would go out on a limb and I would say between the age of 6 and 8. But the other good news that I've got for you, Sarah, is that we have spoken to many people over the years with the same situation as yours, and they've completely overcome it. And ladies who thought they'd never have children, who went on to have children, ladies that were a bit later on in life who'd actually adopted children because they felt that they loved children so much, and that was the only option that they had.
Yeah.
So I can tell you that at some point in the future you can absolutely get over this.
Yeah.
For sure.
Yeah.
And as Eva said, no one is born with a phobia. So that's great, because we know that there's been sections of your life, albeit probably a short period of time, where you live without this issue.
Yeah.
And what we would like to do is, by locating when this started, to take you back to that time that you didn't have this issue. But then from that point, you need to learn how to be around these things as an adult, because you've got no reference.
Oh, yeah.
None. So, do you have any idea where this may have started?
I think I potentially do, because I've been told something.
Okay.
Okay.
I was told, because the first time that I encountered it myself was at secondary school, because I had to have immunisations.
Okay.
And so I was called to the nurse's office and was sat in a chair to have my immunisations, and I basically rejected the situation, and I was pinned down by the school receptionist to have my immunisation, and then I fainted, and then I had to be collected from school.
Okay.
How old
And
would you have been then?
So I would have been about 11 or 12.
So you're 11 or 12, you're going to have an immunisation, you sit down in a chair, you don't want to be there, and who held you down?
The receptionist basically sort of held me in place and was like
Wow.
trying to calm me down, and she was like, you need to have it done, like it's important, like
Okay.
your mum signed the consent form, like it's happening. And it's all a bit of a blur after that point, other than I obviously then fainted.
But the fact that you had a problem then means that something happened prior
Before
to that.
Yeah. So
then
that
once
is-
that happened,
Yeah.
I explained to my mum what happened, and she said, that's interesting, because I remember when you had your jabs when you were about 2, I got a call from the doctors to say, your husband's brought your daughter in for her jabs, but he's fainted. So can you come and collect them both?
And here's a question. Does your dad have a fear of medically things?
So he is not particularly comfortable with them, but he does them. So he has recently been diagnosed with diabetes, and so he's had to have like blood work done and stuff. So he has had that done. So he doesn't like it. Not that anybody likes it, but he does have it done.
Mm-hmm.
So he can do it. But he's not comfortable with it. If we watch TV and say, for example, Casualty comes up on the telly, he'll go, "Oh no, I don't want to watch that."
Okay.
So he's a bit squeamish in that sense.
So, the two main ways that we acquire a phobia are, number one, having a bad experience. And in this situation, the bad experience can be someone having an injection and the injection hurting. And that's literally not the injection, that's down to the person administering the injection. And it can vary so much, but that's one of the causes. And the second cause is copying a parent's behaviour. And in this situation for you, could be a combination of both.
Yeah.
But certainly we know that your dad fainting is a big indicator of that situation, because what you as a child, you see, obviously your parents are your lifeline. You cannot survive without your parents. And knowing that one of your parents has passed out, then that dictates to you as a child, this must be a massively fearful situation. And therefore, I must be aware in the future that I should never put myself in this situation.
Yeah.
Does that make sense?
Yeah, complete sense.
May I ask you a question? Why do you have the accent that you do?
An accent.
Yes.
Yeah, why do you have your accent?
I suppose from my parents bringing me up in a certain place and how they've spoken.
Okay.
Yeah.
Did you have to think about that?
No, it just happened.
Because
I didn't even know it was happening. I just took it on board from them, I suppose.
so you're telling me that you copied that?
Yeah.
I'd just like you to really
Yeah.
take that on, because I have no doubt at all that this is copied behaviour.
Yeah.
And the reason that I know it's copied behaviour is just like you didn't have to think about learning the accent that you have
Yeah.
because you just copied it. If you're watching Casualty and your dad is squeamish,
Yeah.
he's practiced that behaviour through your entire life.
Yeah.
You've observed it and you've put your spin on it. And what always happens, this is without exception, is that, and this is all good news, by the way.
Yeah.
because
Great news.
What this is saying, Sarah, is that actually everything you're displaying is really normal based
Yeah.
upon what you've seen and experienced in your life. But what I can tell you without exception is that when a phobia is copied from a parent, the child is always significantly worse. The reason being is that, let's say, for example, hypothetically, your dad had to have an injection when he was 8 and the school nurse that he had was a bit rough with him and hurt him. He then has a problem. However, he goes on in life just having a problem with injections. That's it. You observe him, but you don't have those parameters.
Yeah.
So you see your dad faint. Oh gosh, that must mean needles. That could be blood. That
Doctor's
must mean
surgery.
doctor's surgery or medical establishments. Then you see him being squeamish on Casualty and other show. That must mean blood. And because you don't have any parameters, you just have to assume it's everything.
Yeah.
And
So
that
it
is-
grows faster.
and that's
Yeah.
why it grows faster.
Yeah.
So the good news is that this actually is copied behaviour. So that's a really great start and then what actually happened is you saw those things in your dad and that learning,
Yeah.
and then you went for that school injection. And actually what happened then was that will have been accelerated, and it will have been accelerated because you were being held down with the best of intentions. I entirely accept that. But when your fight or flight mechanism is kicking in, which is what you were experiencing, your body's saying, get me the hell out of here. And it feels like somebody's holding you against your will. And suddenly it just goes boom.
Because I would say that I have a very sensitive fight or flight response.
You will now.
Yeah, because you started exercising that at such a young age. And, you know, in relation to when you look at any medical intervention or any incident that you might have, falling, hurting yourself, right, it encompasses everything. So you were never in a situation where you can actually fully relax because something could always happen to you, which you could end up being in hospital and needing intervention for. So, which brings us to not how you perceive this situation as a child, but what actually happened. And this is the key to switching this off and changing your life, basically, and giving that hope back.
Before we do that, with what we've just said there, is there anything that you want to challenge? Anything you want to ask?
No, it makes complete sense.
Good. Okay. That's good. So that's the first step, is understanding that.
Okay.
And if I can just add that, like I said before, that a phobia by definition is an irrational fear. And the way that you can start to overcome an irrational fear is by rationalizing, not as an adult, because realistically, that medical intervention doesn't.
Well, I was going to ask.
So
I was going to ask, why do we have hospitals?
So, but that. However, you had to hold on to it because you didn't have an explanation for it. And what actually, by being able to start to rationalise it, it starts to break down those irrational barriers that we've put in place, because suddenly it's like, but that actually doesn't make sense because I now know that this was copied. Okay.
So, and because your dad obviously had some issue in his life that made him fearful. We know that he had something, we don't know what it was, but he was fearful. But even your dad is now overcome that because he's having to inject on a daily basis. So my first question to you, so we can, get this out into the open. The first question to you is, are you pleased that your dad can have injections on a daily basis to help him with his health condition?
Yeah, of course. I'm really proud of him, because it's like watching him do hopefully what I would like to do, which is overcome it. Okay.
So knowing that your dad has been able to overcome it because he had a reason for it happening in the first place, you didn't have a reason for it happening. Because of why? What caused it?
I suppose I don't really know.
Okay, you did tell us earlier.
Oh, what caused my fear?
Yeah.
Oh, what watching him faint when I had my injection.
Okay, so who caused the problem?
I suppose he did. But I feel bad blaming him.
Can I just give your dad a bit of a break?
Yeah.
Your dad never took you to have... He took you to have your inoculations to help you.
Protect me, yeah.
To protect you. Okay. And he thought, knowing that he had a problem, he still went.
Yeah.
Right? Because he loves you and he wanted to protect you.
Yeah.
Unfortunately, it didn't work out well.
No.
Right? Your dad did not do that on purpose.
No, he didn't.
Okay.
Yeah.
So we're not apportioning blame here.
Yeah.
Right? But what you've done, you've apportioned blame to something.
Yeah.
Incorrectly.
Yeah, of course, yeah.
What did you blame?
I suppose I partly blamed him, but it's not his fault.
Actually, you didn't blame him. You blamed something else. That's the problem.
Oh, I blamed the injection.
Yes, you did.
Oh, I've just had had an epiphany.
Oh, right.
Yeah.
Epiphanies are good.
Yeah.
Yeah.
That's exactly what you did.
You blamed the injection. You blamed the doctor's surgery, whatever it was.
Surgery, yeah.
Everything, right? You blame the doctor who was giving you the injection.
Yeah.
But who should you have blamed?
I don't know. Anybody deserves any blame.
But what caused it?
Me watching my dad faint, I suppose.
So we're saying it was your dad fainting.
I don't know, because I'm so
You
small.
see-
it's hard
you see,
to
you're-
like
I
pinpoint
understand.
where
What-
I'm like.
No, I understand.
Yeah.
What you're doing here as well a bit is you're trying to protect your dad in that you're like, I can't say it's my dad's fault because I love my dad and my
Yeah.
dad didn't do it on purpose. And we know that your dad did not. But on any look, your dad's intentions were all fabulous, and the poor guy fainted in that moment.
But what you're doing as an adult, you're applying logic, right? But what we want you to consider is you as that little girl who suddenly sees her protector faint. Then what does that mean to her? She's
Yeah.
in danger.
Yeah.
Leaving her with a bunch of strangers.
Yeah.
She's in absolute danger.
Yeah.
But and therefore, what do? You blame that whole situation.
Yeah.
But the one thing that caused it, you don't blame because you love him so much.
Yeah.
And he didn't do it on purpose.
No.
Okay. But now it's out in the open. What caused that problem that day for you?
I suppose watching my dad and then him leaving me in a scary situation. Like you
Okay.
say, I was small and I wasn't.
Absolutely.
So who
Have-
caused it?
Are we saying it's my dad? Yeah.
Sorry.
The poor dad.
Poor dad. But
Okay.
Dad, we love you, and we know
We
it
know
wasn't
we've already.
your fault.
It's
Yeah.
not his fault, right?
It's
but,
not his fault.
But for that little girl, who caused that problem?
Yeah, my dad.
Yeah.
Okay.
Yeah.
Because
So
had he not fainted that day?
Who knows?
nothing. Well, I can tell you
Yeah.
nothing, right? So bear in mind your dad caused the problem. Why do you want to blame the doctor? Why do you want to blame the injections? Because that's unfair, isn't
yeah.
it?
Yeah.
And if they'd have been that bad, why did your dad take you?
Yeah.
Because realistically, this was nothing to do with you. This was his issue, and
Yeah.
you've stolen it,
Yeah.
and it was his
Yeah.
issue. And even then, if your dad, your protector, really thought that there was an issue, would he have taken you?
No. And like with the kids I work with, I've taken them to all their immunisations. I've hated every second of it, but I've taken them because it's important. But I don't know, when it's me, it's like all of a sudden it's a different kettle of fish. I don't want it anywhere near me.
Yeah, but
No, I
just
understand that.
we understand that. But if you blame something,
Yeah.
then you want to avoid it,
Yeah.
and you've blamed doctors, surgeries, doctors, and injections. But what we're saying to you today is that fair to blame those things because they didn't do anything,
No.
right? And not only did they not do anything to harm you, they actually did things to protect you.
Yeah. Mm.
And when you fully accept that, you can let this go.
Yeah.
Because the problem wasn't caused by anything to do with any medical intervention.
No.
The problem was caused because your dad fainted.
Yeah.
And
That's it.
interestingly, you didn't say, "Oh, my dad is this and my dad's got that." You actually just said, "He watches TV and he's squeamish."
Mm.
Many people are squeamish,
Yeah, a lot of people are squeamish.
and that's okay.
Yeah.
That's okay. But you, because you were little, you kind of clung on to every eventuality and added loads and
Yeah.
loads into it.
Yeah.
But ultimately, do you love your parents?
Yeah, of course.
Okay,
yeah.
so if they needed inoculations, if they needed bloods taken, if they needed to be hospitalised, what would you want?
Yeah, for them to have it.
Why?
Of course, because it's best for them. And it's really hard, isn't it? Because it's like what you were saying earlier. I can see in my mind how irrational it is.
Of course you
I
can.
know that it's
But-
going to be for my best interest, but it's such an uncomfortable situation and makes me feel so scared and faint and horrible that I just completely avoid.
But what's going on, Sarah, is the fact that you're saying that now as an adult and you're talking logically.
Yeah.
Yes.
Right, and you want to do this because that's how you see it, right? Medical intervention is critical
Yeah.
for us. It's really important when we're struggling,
Yeah.
right? But you created this little, it's called a schema, but it's like
Reference.
like an app that you created as a young child, and you saw your protector faint. The danger was that bad, he passed out. So now that becomes your reference. So even though you're saying, I want to be okay with this, as soon as you get in any of those situations, this app fires up and the reference runs.
Yeah.
And that app that you created back when you were little, you then got further confirmation throughout your life
Yeah.
when your dad was watching any medical interventions or anything on the TV.
Yeah.
But what we want you to take away,
Consider.
the hope we want to give you today, is the fact that there's no medical intervention that's ever harmed you. Every medical intervention you've ever had was to protect you and for your safety.
Yeah.
And what all that happened in this situation is a little girl misunderstood something.
Yeah.
That's all it is. And once you can take that on board and you can realise that it's not the fault of medical intervention or injections, this was a little girl who was upset because her dad fainted.
Yeah.
And once you can split the two,
Yeah.
you can let this go.
It does
Yeah.
start to feel. I mean, you said that was an epiphany.
Yeah.
And the thing is, our thoughts create our feelings, and our feelings create our behaviours. So when we have new thoughts, we have new feelings, new behaviours. And if we have a better thought, then we have a better feeling and better behaviour. So knowing actually today that, oh, hang on a second, this actually was nothing to do with anything medical.
No.
This was just seeing my dad.
Yeah.
Then things start to change.
Yeah.
Oh, there's one thing that we didn't confirm here. As a little girl, you just saw your dad fall to the floor. You must have thought he died.
Yeah.
That would make sense.
I wouldn't have known any different.
Yeah.
Yeah.
So how did you as a little girl manage to grow up without a father? That must have been very difficult.
Well, luckily I didn't. But yeah, I suppose I have to be.
Oh, hang on a second.
Oh,
Just
hold on.
wait. So are we say? So he didn't die that day.
No.
So even faced with all of that, did anything go wrong?
No.
So have you just told me? I don't know. Is that
Why does it sound like it? It sounded like it was me.
that was
to
in
me.
stereo, that.
So
Right,
sorry.
Yeah,
No,
so
I think
like,
it
no,
was
don't
stereo.
worry.
I think mine went
Yeah,
at the same time. I
um,
don't know.
So have you just told us, Sarah, that that day you got it wrong?
Yeah. I didn't see the full picture.
Okay.
And what was the picture? What actually happened?
That he just fainted and then he was all right.
I love that.
Right, yeah.
I love
Yeah,
that.
he's all right. That's amazing.
He's
and
fine.
he's all right.
Yeah.
And thanks to medical intervention in his life, he's been, through having blood tests, he's been diagnosed with diabetes and he's getting the medication that he needs.
Hang on. So we're saying that blood test might have saved his life?
Yeah. I believe we are.
Oh.
And are we saying that
he
the-
didn't die? Let's just start afresh here for a second, right?
He's going to love all the airtime
Right.
he's getting.
Yeah, no. Yeah, but come on. So you thought he were dead, but he wasn't. You thought that he was frightened of medical intervention, and he might have been squeamish, but because of medical intervention, it was uncovered that he had diabetes, and he got medication that he needs to help him to keep him alive. Is that what we're saying?
Yeah, that does seem like that's what we're saying.
Oh, so what's actually going to keep him alive?
Yeah, medical intervention.
And what kind of intervention would that be?
Oh, I think it might be blood tests and things that I don't particularly like.
Oh. Well, it's just as well that you allow your dad to have those
Yeah.
things.
Oh, no, good.
So, if they were so bad, surely you wouldn't allow your dad to have them, would you?
No. They can't be all bad, can they?
I don't think so.
No. Yeah.
It's a lot to process.
Yeah, it's hard because it's still the
But-
things that I just really don't want anywhere near me.
Well, and I
but-
think that and again, this is something to be aware of, actually, which is, I'm glad you just said that, because I think that when you've lived with a phobia for so long, you don't learn the norm.
yeah.
So what I mean by that is I can just go about my daily life, or I could just go and have a blood test for no reason. I ain't going having a blood test for no reason.
Yeah.
I don't want medical intervention.
Yeah.
I don't want to have blood tests. I don't want to have injections.
Yeah.
But if it comes to it, and I need to have those things done, I'm not going to go, yeah, Nick, guess what? I'm going
Yeah.
to. I would never say that.
No.
Ever.
But I go with it because there's a bigger picture to go with that. Just like you said, you take the children that you look after to have their inoculations.
Yeah.
that's not something, even taking my kids, I didn't want to do that,
No.
but I do because we know sensibly it's the right thing to do.
Yeah.
So what you've got actually, Sarah, and this is just something to be aware of, that as you start to process what we've discussed, that you actually have no reference for what's normal.
No.
Because you're pretty much your entire life,
Yeah.
your reference has been, holy crap, we've got to just avoid this at all costs.
Yeah, it's become almost like part of my
Yeah.
personality,
Absolutely.
like who I am.
Exactly.
But,
So
but now you understand it was a flawed reference.
Yeah.
Right? It's a flawed reference. And for me, right, I don't want to go to a hospital because if I'm going for myself, then there's obviously something wrong with me that I need intervention for, or I'm going visiting someone else who's also ill, right? So again, it's not somewhere that I would choose to go and somewhere that I don't want to go.
No.
However, if it's required, then it is very, very important.
Yeah.
And the difference is being able to go and think, this is going to lead to a good outcome,
Yeah.
right? And for your dad, amazing outcome.
Yeah.
Yeah.
And again, and also now, and because we've given you some new information, we've basically updated that app that you've been using. And there is a lot of habitual behaviour and a lot of learning for you to go through now because you
Yeah.
haven't got a reference. But what we've actually done is we've updated that app. We've made the irrational a bit more rational because you now have an understanding
Yeah.
as to why. And then what happens when the irrational changes to irrational is that we can start to put things into perspective in a better way. Because if you think about the conversation on the train now and
Yeah.
think about that should actually feel a bit easier. So just go there now.
Yeah. Yeah. So nothing's going to happen to me because she's just having a conversation. Yeah. I've got no reason to be.
And look at that, you're saying
Scared.
that now
In
with
a calm
no,
manner.
Yeah.
yeah, really, really calm.
Yeah.
Yeah.
So that's totally changed.
Yeah.
And that's now something that we hope within our Hope Clinic, we've now helped to update your app when it comes to medical intervention.
Yeah.
Because you now have a logic behind it. You now have an understanding. And more so, you actually, probably of the three of us, because of your dad, you have actually more evidence of how fantastic medical intervention is. Because
Yeah.
not only has it identified that there's an issue, thanks to medical intervention, thanks to having medication through injections, your dad's going to live a normal life, which he otherwise may not have.
But also, thanks to medical intervention, people can have children. And if your employers didn't have medical intervention, you would not be able to be a nanny because
Yeah.
you won't have kids to look after.
No.
So when you consider all those things, essentially what we're talking about is a little girl who witnessed an experience
That's scary.
that was very frightening, very
Yeah.
scary. She felt that she was in danger. She felt that a protector had left her. But ultimately, it was something that she got wrong. Like all little girls get things wrong. And what you've been doing as an adult, Sarah, is whenever you're in a situation that could lead to medical intervention, you've been saying, how should I behave? And you've found this memory, and you've been asking this little girl.
Yeah.
Or using her
Her
opinion and her
yeah,
reference.
her
realistically.
mistake.
Which is why, as an adult, you can say, I know it's ridiculous,
Yeah.
but because the reference was set up then, it's still utilising that same belief. But again, we've offered you some new evidence today
Yeah.
to help you actually to start to put that into
I
perspective.
have got one thing just to add on top of this. So we're saying that maybe you were a 2, 3, 4-year-old little girl. So I'd just like to ask, when in recent times you've had any major decisions to make in your life, should I take that job, should I do this, should I do that?
Yeah.
Do you often look for a little girl and run it by her?
Well, it sounds like I do because I avoid, I've been in my job. The children I look after aren't even babies anymore. They're like fully fledged kids at school.
You obviously
And the
love them.
idea of going to a new job means that I'd have to do a first aid course. I'd have to take babies to inoculations again. I'd be starting from scratch. So I know I'd have to go through all the processes I've been through that I've been avoiding previously.
But thinking about that now with the new information that you've got, and just to reiterate, was your issue ever anything to do with needles?
Well, no, they didn't do anything wrong. Yeah.
And was this ever to do with medical staff?
No, they've never done anything wrong.
Was it ever anything to do with hospitals?
No.
And was it ever anything to do with blood?
No.
So is it fair for you to carry on blaming all those things when
No.
doing nothing wrong?
No, it's not.
And if you think about taking, and again, like I said to you, don't be hard on yourself here, because you've not really got any references
No.
that you can go, oh, but I remember before my phobia started, I remember doing that and it would be okay.
Yeah, no, I
You
don't
haven't
have
got
that. I've
that.
lived with it my whole
However,
life.
what
yeah.
you do have is the knowledge that you have taken children for inoculations.
Yeah.
And what went wrong?
Nothing.
Exactly.
Yeah.
And then, you know, your dad's been in hospital recently or had medical intervention. And what actually went wrong?
Yeah, nothing.
Okay. So if you ever needed medical intervention, what's going to go wrong?
Hopefully nothing.
Exactly.
Yeah.
I've got to say, sat here looking at you, you look like a different person right now.
Tell us.
Can you feel that?
A little bit, yeah. I feel more rational.
And that's what, and
Yeah.
that is realistically, that is the start of your journey.
Yeah.
Well, you know, I said hope brings healing. When we hope we can get better, we start to look for solutions and we start to listen to new evidence, and that then leads to our healing over time.
Yeah.
But knowing that some of the words that you used, I feel quite confident that there's been a shift.
Yeah.
And just watching your body language, I feel there's been a shift.
Yeah.
And obviously that's down to you to experience that. But even if you think
Yeah.
about the time when you were 11 and you had what you needed to have done in that scenario,
Yeah.
but realistically, which was the worst point?
Yeah, the fainting really, rather than the actual, the injection.
And what about being held down?
Yeah,
How pleasant was that?
not ideal. No, not
No.
great.
No.
So realistically, even in that reference,
Yeah,
probably the least scary bit or the least painful or the sort of the smallest thing that actually was most irrelevant
yeah.
was the injection itself.
Well,
wasn't it?
yeah, exactly that, because it's more the uncomfortable feeling before and the potential outcome of me fainting afterwards. It's not the actual thing happening to me.
Interesting that you use that fainting. One of you,
Oh yeah, I fainted quite a few times.
right? But it's interesting that you use that as an outcome, and because your most recent time, you said that it was really uncomfortable for you, but you had the COVID jab, right? But did the jab hurt?
No. Yeah.
Right. So all the blame that you've apportioned to injections, to any medical intervention, has been totally wrong, because when you've had it and you've got a reference there in adulthood,
Yeah.
that didn't hurt.
No.
It was everything that you made up
Yeah, the build up.
to get there.
Yeah.
Right. But those are just thoughts, and those thoughts that cause the uncomfortable feelings are thoughts based on this app that you created as a little girl. And when that app's deleted and closed down, then you can't have those feelings anymore.
Yeah. Yeah.
But-
Need a new point of reference.
Well, the new point of reference is
Dad.
medical intervention saves lives.
Yeah.
It saved your dad.
Yeah.
You know, people can go into diabetic comas, right? And fortunately, because your dad's testing his blood on a daily basis, having insulin, he's going to be okay.
Yeah.
So how can you say medical intervention isn't a great thing?
Yeah, no, I'm not. I'm not saying that. It's good.
Yeah.
I just don't like it.
No, but then
Well,
neither do I.
I've got to say that I'd like to say I didn't like it, because now we've given you some new information, and the fact is
You've never given it a fair chance.
you've never
basically.
given
Yeah.
it a chance. So, may I ask how old you are?
34.
So basically, in 30 years,
Yeah.
you've had the incorrect view,
Yeah.
and now we've shown you something different. And so now, if you imagine that a set of scales and you got this on this side, medical intervention is bad, and then when you find out that medical intervention is bad, then what happens? You look for further evidence to back up that belief that you
Yeah.
created. So if you look at scales, they're massively tilted towards evidence, medical intervention being bad.
Yeah.
So now we've given you and correct me if I'm wrong, correct evidence as to how you should look at medical interventions
Yeah.
and anything to do with medicine or hospitals. We've given you this evidence on this side, but look, there's a lot for it to filter and tip.
Yeah.
Now, the great thing is once it tips, can't go back.
No.
Right? And you're just going through that processing period of 30 years versus 30 minutes.
Yeah.
But I know that you've made that shift. I can see it in your physiology. I saw it when you said that you've not seen it that way before, and you've had an epiphany. And I can see that you've changed, Sarah, and I'm so delighted.
Yeah.
Keep in touch. Let us know how you get on.
Yeah, I
And
will.
I hope that your half hour of hope has given you hope that actually you're now on a better journey.
Yeah, no, it has. It really has.
That's lovely to hear.
Thank
well
you.
done. What a difference from when Sarah walked in to when she walked out.
Massive, yeah.
So incredible. When I said to her, when she sat down, she was literally like a coiled spring. And it's like she just let it all go. I mean, massive difference.
I mean, it was, again, you can literally see like a weight get lifted. Just knowing and understanding your behaviours, you can start to make sense of them. And then once you can make sense of them, you can realise, oh gosh, yeah, I did get that wrong.
Yeah. And it's interesting, isn't it? Because you referenced in that chat about sleep and how, did she have trouble sleeping? And I think a lot of people that struggle with anxiety or even trauma, that they do struggle sleeping and they don't put the two and two together. It's something obviously we find a lot in clinic, that people don't put those two and two together. But when you think about it, how can you ever let yourself rest fully when you're always on high alert? Like in her case, there were so many things that she was constantly watching out for. Obviously, it makes you really fatigued and you're absolutely exhausted because it's like you're constantly on a work shift. It's like being a guard, isn't it? Constantly being on shift.
Oh, unbelievable. When she said, when I'm in the dishwasher.
Everything.
With the knives.
Everything.
Who even gets to that thought process?
Yeah. So you're massively fatigued, but then you can't sleep fully because you can never fully switch. You've not switched that program off. I mean, you used a computer analogy, and it's like that, isn't it? It's like that program's running in the background.
Yeah, it's
so your computer
minimised.
can't
You
shut
might
down.
be trying to sleep, but it's minimised, but it's still not closed. It's open. It's still running because, like you said, it's like being a 24-hour bodyguard to yourself. You're on that watch all the time. But I think the thing that really hit me was the fact that something that happened at 2, a misunderstanding at 2, has potentially stopped her from having a relationship and having children.
Yeah.
And that really saddened me because what a beautiful girl, she's got a gorgeous personality and she's not been able to share her life with anyone because of this issue. And that really broke my heart.
Yeah, it's interesting, isn't it, how these things just grow and progress and, what can be to one person kind of seemingly not a big deal. I mean, not so much this, but other phobias where people go, well, how does that really affect you? It's not that big of a deal. But how these things grow and can become such huge things that take over such huge elements of your life.
And how we just live our life around them and accept.
I think
Accept that, well, yeah, I've never had a relationship and, and what does the future hold? Well, does that mean you're never going to have one? You're never going to have children? And, I was quite shocked hearing that.
Yeah.
And it just makes me think that we should take stock of our lives on a regular basis and go, what is it that I can't do? What is it that I should be doing? And asking those questions, because I know that Sarah's life will completely change now.
I think one thing that, on the face of it, looking at Sarah, and I'm sure, listening to the podcast, people are going to go, oh, it can't be that easy. It can't be that easy to overcome an issue. But on the face of it, Sarah's situation and her issue, people would class that as deep-rooted or, it was, very complicated.
Well, yeah, she's never known life without it.
Absolutely. But equally, what we've got to accept and realise is that she created that phobia within an instant. Seeing a dad go fainting, it happened in an instant. So why should it take months and years to actually overcome it?
Yeah.
And ultimately, and I think you said it, Nick, that the reason that she is so hyper vigilant and so hyper anxious, or has been till today, is because this has been this issue, this behaviour, this fear is like a road so well travelled.
Yeah, absolutely. And that's, what we call neuroplasticity in the brain, isn't it? This idea that basically our brain is constantly changing and adapting to our environment. It's not stagnant. It doesn't stay as it is. Throughout our lives, it constantly changes. And so if we basically tell it, it's like exercising a muscle, that, you know, this is something to be aware of. You're constantly treading that same path, constantly exercising that anxiety reference. So those neural pathways in the brain are just getting stronger and stronger and stronger. And what will now start to happen is the brain also goes through a process of pruning, which is where it gets rid of things that we're no longer using. Now that she'll stop using that reference of
The
that
negative
anxiety. Yeah, absolutely. That will become weaker, and she will start to create new, more positive references now that she's seen the situation as a positive, because that situation with her dad, she's seen that as such a traumatic memory in this horrific place, this hospital, because he fainted there and it's just horrible and super scary. When actually, you know, if her dad was going to faint, he was in the best possible place for it. You know, where would you want to be if you were going to faint?
Absolutely.
Around medical professionals, right? You know, but she'd never seen it that way. And I think another thing as well that we hear so often is people say, well, it can't be that I copied my parent because theirs isn't as bad as mine. And I think that was one thing that she kind of said when you questioned her on, you know, does your dad have an issue? Well, he's a bit squeamish, but it's not like what I've got, because she obviously thought, well, there's no way it can be that because his is nowhere near as bad as mine. But actually, that's pretty much always the case.
It is.
You know, if someone's copied something from a parent, theirs is usually 10 times worse.
Always.
And that's why people often discredit that. But actually, that can be pretty much always the case, that it is worse and it's more exaggerated, or, you know, you add more triggers in because maybe, you know, the parent had it from sort of a later point. Maybe theirs progressed a lot slower, whereas you've seen it from, you know, such a young age that you've added so many more things in and it's grown from childhood, basically.
I think that today has been incredible, and I'm so excited for Sarah's future, and I can't wait to get the updates.